Ladies and gentlemen, good morning, good afternoon, good evening, depending where you are. I'm Ana Lucia Jacome, Senior Project Leader at the Division for People and Social Inclusion at UNITAR. The topic for this time event is UN in the Field, Empowerment and Alignment in the Work to Strengthen the Protection and Participation of Older Persons. This space will be the opportunity to bring together the experience of UN entities in the field from different perspectives, including humanitarian efforts to support the implementation of the commitments assumed by states related to older persons, as well as to different stakeholders working towards the same goal. Now, let me give the floor to our moderator, Mr. Alex Mejia, Director of the Division for People and Social Inclusion. Please, dear Alex, you have the floor.
Thank you very much, dear Ana Lucia. Thank you to all of our speakers. We are very pleased to be able to host this very interesting conversation that will ensue going forward. For UNITAR, it has always been a privilege to join forces with other United Nations agencies and colleagues for two reasons mainly. Number one, of course, to build capacity, to raise awareness as we are doing here today on issues that are priorities for society. But the second, very particular, is to support the several decades of action that we have. Several examples come to mind. We are very committed to the issues of disabilities, to issues of road safety, and so on and so forth. But if there is one that is rather special for us, is this decade of healthy aging. We have been engaged with the WHO and several other UN agencies, as you're going to hear, to contribute to that. And the decade of healthy aging, of course, is not only a priority, but a very strategic thing to do and to discuss. So with that in mind today, we are going to open the floor right now with some inputs, opinions, and particularly some important pieces of information that will serve as well to have a conversation about this issue. Without further ado, and as you know the agenda, I would like to give the floor to the representative of UNITAR, the agency that I am also with, and in this case is our Chief of Staff, the Chief of the Office of the Executive Director, Mr. Jonas Harley, a colleague that I greatly admire and appreciate. He will be speaking on behalf of the Executive Director of UNITAR, Mr. Nikhil Seth, who had just been excused. So dear Jonas, the floor is yours.
Thank you very much, Alex. And dear participants, apologies, our Executive Director is unavailable on a very short notice, so I'm sitting in for him and send you his greetings. And I'm going to read his statement that he prepared for this event today. So, ladies and gentlemen, it is a pleasure to welcome you all to this fifth and last event of the year of the virtual roundtable series, Mainstreaming Knowledge on Aging. Through this journey, we have had the opportunity to better understand the current scenario on the protection and inclusion of older people as a basis to take stock on good practices and challenges, including standards, policies, and strategies. And that is all with a view to strengthening and building further synergies and engaging different actors. So many of you are convening here today. If we look back, the human rights of older people and frontier issues such as the democratic worldwide scenario, human mobility, digital divide, and climate change have been at the heart of these discussions. This has been complemented by information on different dynamics in New York and Geneva as the main scenarios for discussion on the topic and in the framework of the UN system. Likewise, we have had the opportunity to learn from experiences at local, regional, and national level, and about the potential of some mechanisms and initiatives towards the implementation of effective practices to promote an active, free, and meaningful participation of older persons as well as their protection. Sharing these voices from those who have been directly involved in advocacy and actions, as well as the experiences by UN entities in the field, has also been covered during this series here. In this regard, we have considered age, gender, geographic, and sector balance, as well as the diversity elements to invite distinguished speakers to enrich our discussions. These inspiring experiences, as well as the participation of attendees from all regions around the world, despite the time zones, represent a motivation to keep working together on upcoming initiatives and to overcome these challenges. More than 600 persons have actually registered to attend this series, and those who have joined us have at least attended 75% in each event. They have access to certificates and of participation, the takeaway materials and related videos. So ladies and gentlemen, for this initiative, the UN Decade of Healthy Aging has triggered our interest to approach other UN entities as a family, and as well as states, academia, and non-governmental organizations, as well as the private sector. All of them have the potential to move forward from theory to practice. UNITAR, the organization that is co-organizing this event, celebrates the outcome of this series as a joint initiative with its 27 international training centers for authorities and leaders, UNDESA, UNFPA, the International Organization on Migration, UN Women, UNHCR, the World Health Organization, ITU, and the Office of the High Commissioner for Human Rights, together with the groups of state friends of older persons in New York and Geneva. Respectively, the International Network for the Prevention of Elder Abuses, the International Longevity Center, and the Global Initiative on Aging Foundations have all been partners here. We take this opportunity to reiterate our appreciation for this significant partnership, looking forward to continuing our collaboration. Fostering cooperation in this regard is a key aspect to achieve the commitments assumed under different international instruments and those pending tasks. In addition, we would like to express our sincere appreciation to Madame Claudia Mahler, the UN independent expert on the human rights of older persons, for her guidance and support in this initiative. We are grateful for the mentioning of this initiative by the UN Secretary General in his report to the General Assembly on 7 July this year. As UNITA, we strongly believe in the impact of knowledge as a powerful tool for transforming the lives of individuals and societies. It pursues the change of in the pursuit of the change of different practices. Therefore, the creation of spaces and initiatives to raise awareness, such as this series here, represents an opportunity to enhance capabilities towards a culture of learning. Leaving no one behind implies to address different vulnerabilities, including those coming from aging. Therefore, strengths and challenges of this process should always be considered. Persons become actors in their own destinies. Finally, we thank all of you once again and warmly invite you to keep joining us during this upcoming learning activity and also next year. Stay tuned. Thank you, and I hand over to our moderator.
Thank you very much, Jonas. Always appreciative of the time that you take to support this, and particularly when you speak on behalf of Mr. Seth, Executive Director of UNITAR. Now, I appreciate also that you have walked us through some of the highlights of this year series. This is event number 5 out of 5, and God willing, we will repeat this series or something similar in 2023. With the support of all of you, of course, our dear partners. I believe that this endeavor is really strategic, as I mentioned at the beginning. Now, after listening from UNITAR, now we will be doing this imaginary mental journey around the world with speakers from all of the regions in which the United Nations operates. And to begin with that, I would like to properly introduce Dr. Rintaro Mori, who is the Regional Advisor for Population, Aging and Sustainable Development in the Asia Pacific Regional Office of the UN Population Fund, UNFPA. Dr. Mori is a senior pediatrician with studies on epidemiology and public health. He has pursued his research on the life course approach to achieve sustainable social and healthcare systems in the context of population aging since the year 2012, a decade already. He took up the job that he has now at UNFPA in 2018, at the same time that he's a visiting professor at the Graduate School of Medicine of Kyoto University, with vast experience, I should say, in Japan, Australia, Nepal, and also the UK. He is also involved in research aid works and researching health systems, as well as women's and children's health at national and global level in Madagascar, Bangladesh, and Mongolia. Last but not least, and as part of its core commitment to empowering women and girls within a life cycle approach, in recent years, the UNFPA has adopted a model which demonstrates the trajectories by which newborn babies and then girls move through their lives into adulthood and older age. A job that we greatly commend from UNITAR and that we recommend everyone listening to actually take a look at. So without further ado, it is my great pleasure to properly welcome and offer the floor to Mr. Rintaro Mori. The floor is yours.
Thank you very much for your kind introduction, and really actually thank you for UNITAR colleagues to facilitate this our excellent opportunity to talk about important issue. And yes, I'm working the sort of the Asia Pacific region. We think it's one of the forefront regions actually in terms of the population age. The China, we have the highest number of older persons in the world. The Republic of Korea, it's the fastest aging country in the world. And Japan, my home country, is the most aged country in the world. But not only these countries, the country like Thailand, Malaysia, Iran, and the Sri Lanka, the Indonesia, we've been doing the lots of very different type of the field work programs. So it's really the pressing issues, and I think we often work not only for the population aging issues, but also the law fertility as well, because often coupled together in our region. So today, I really want to focus on our life cycle approach. Why is that? You know, we have several sort of the high-income countries in our region, like the Republic of Korea and Japan and Australia, New Zealand, Singapore. They're Asian, but they started with the sort of of course the policy support for the older persons, but later on, all of them actually all of these high-income countries recognize that investing early is very important for actually sort of supporting older persons. So today I really want to focus on this sort of the life cycle approach. I'm going to share the sort of my sort of the slide. It's a sort of let me just quick notch. Just one second. Just give us 2 slides. Then I think to show you the sort of why we actually think it's very important to. Is that?
Yes, just make it a slideshow. Thank you very much.
No worries. It's just
perfect.
Good. So you can see that sort of the first slide. You know, think about sort of the adolescent girl. Her pathway. Every stage, every moment. I think the sort of her choice, whether it's a school or the employment, or the issues in the sort of our region, the child marriage, or the pregnancy, or the sort of the work-life balance, and the sort of any sort of the issues and health issues. You can see that the chain of the event. So, and I think you look at the sort of the older person these days, the many issues are related to the sort of the lifetime event. So it's all actually sort of not necessarily all, but often many issues or many determinants. Even actually decade of healthy aging, we actually sort of focus on health issues. That's, I mean, one of the most sort of the biggest actually risk factors for the determinants of the healthy aging is actually sort of the kind of lifestyles. For example, the hypertension, diabetes, and that's all related to the sort of the eating sort of the behaviors or the exercise. That's often all sort of the lifetime kind of the habits. And if you actually sort of think about sort of your private life, that private life, event in the private life has a sort of a huge impact on your actually sort of the lifestyles as well. So really want to sort of focus on that. But I think we actually put all of them in the sort of the video together. So I guess I think I'd like to show you this actual video to run through to show you why we think it's very important to sort of go on to sort of every stage of particularly, I think, focus on women.
Welcome to the future. It is 2050. In Asia Pacific, 1 in 4 people are above the age of 60. The majority of them are women. Is she healthy? Is she financially secure? Is she active? Is she happy? Let's rewind. Today, the world's demography is rapidly changing. Women are having fewer babies. People are living longer. Asia Pacific is at the forefront of population aging. But is the region growing older before it grows richer? To bridge the income gap, we must bridge the gender gap. Every girl should have access to quality healthcare and education. She should be equipped with skills and knowledge that set a foundation for life and love. Every woman should have access to rights-based family planning so that she can choose her lifelong pathway. She should be able to decide whether she wants to have children, and if so, when, how many, and with whom. She needs to be able to deliver her baby safely, improving her long-term health as well as the health of her child. She needs to be safe from violence and be in healthy and happy relationships. She needs to be given equal opportunity to actively contribute to society. Only then can she age with dignity. Only then can we age with dignity. A life cycle approach paves the way for a healthy life, a prosperous life, a happy life. We need to start early. We need to start now. There's little time to lose.
Excellent.
So I'm really sort of looking forward to having more sort of conversations on the our programs, and I think the colleagues in a different region. Thank you very much.
Thanks to you. And let me just react briefly to that video to properly thank you. I think it's excellent to see the whole and to understand the main messages that we should embrace, not only as a United Nations system, but as the whole of society. So thank you for sharing it. And also thank you for the previous slide that captures very well your message. Now, we will continue in this conversation with a geographic focus, hopefully a global one. And now is the turn of the Arab region. In that light, let me warmly welcome Madame Sarah Salman, who is the Regional Advisor on Population Affairs at the UN Economic and Social Commission for Western Asia. She is the top officer in charge of aging, population, and migration in the region, and is also a public policy specialist with expertise on aging, migration, and democratic governance in that part of the world. She has vast experience in institutional strengthening, developing initiative knowledge products, and managing international projects. She has worked before with a number of international organizations, including the World Bank and UNDP, the United Nations Development Program. So it's a great privilege to have someone like Madame Salman. And without further ado, I would like to offer her the floor. Welcome, Sarah.
Thank you, Alex. And it's a pleasure to be on this panel today. If you allow me just 1 sec to share my screen, please.
Of course.
Thank you.
We see it, you just need to put it in yes, presentation mode. Thank you.
Okay, so I will try to be very brief and to leave room for questions and comments later on. Just a quick few remarks. A lot of the people ask us, why do we work on aging in the Arab region? For those of you who might not know, currently youth in our region constitute around 34% of our population, while older persons are a mere 5%. We're a very young region. And when I say who, people ask us, that means also our governments. And they say, listen, we have so many competing priorities that we don't necessarily have the time, the money, the effort to focus on this group. This was a few years back. The rhetoric, however, in our region is changing, and governments and other partners are becoming more aware of why this is a pressing issue. I'm not going to go into too many details and too many numbers, but we are witnessing a very fast-paced aging transition. On average, countries in the region will take around 36 years to complete their aging transition. So going from 7% to 14% to start qualifying as aged. By 2040, most of our countries in the region would have started their aging transition. And the numbers, not just the percentages, but the numbers of older persons are also growing significantly, from around 20+ million today to more than 72 million in 2050. So the time really is extremely tight when we think about what is needed in terms of providing the infrastructure that would support countries to age and to support older persons today and in the future to age with dignity. The future is looking bleak, in all honesty. If we look at where we are, older persons suffer from extreme high income insecurity. To give you an example, around 70% of older persons in 10 of the countries we studied do not receive a pension. And the numbers are not necessarily more promising today if we are to project to the future, given the large informality that we have. A lot of the people are outside the contributory social protection platforms, the minimum contribution of women to the labor market, and therefore making women more vulnerable to income insecurity in the future. So, income insecurity is definitely something to be worried about. The other thing is poor health coverage and accessibility to health services. In some of the countries where we work, especially in the LDCs, expenditure on health from pocket is more than 70%. And so the issue of exclusion in health coverage is definitely a priority for our governments, for older persons and for their families. Discrimination and the negative stereotypes. In our culture, and as I'm sure in many other cultures, we have this respect and honor for our older persons. However, they are looked at as not necessarily active or contributory to the society, more as dependents, and therefore people that deserve our sympathy, but not necessarily people that could be actors of change. Illiteracy, another issue that we face and we struggle with. In some countries, in some regions in them, you can have more than 90% illiteracy among older adults, which of course impacts the quality of their life. I want to speak very briefly, but I'll be more than happy to give more and more information for those that are interested. The point of today's discussion is to say, okay, what are we doing in the field and how can maybe work better together and do a better job moving forward? What we have been doing is three things, which I would say would be similar perhaps across the agencies. We try to build knowledge. We build the capacity of governments and other actors, and we focus on national and regional dialogues, and all of them basically with the purpose of developing the policy framework that govern older persons and aging issues in our region. To give you an example of some of the knowledge building that we have done, our series on population and development reports, the last two issues were on aging and older persons. The last one was particularly on building forward better for older persons and reflecting on the lessons learned, basically from COVID. We also had a series of briefs on the subject. We also had a toolkit, which I think is in line with the title of this meeting, which is Mainstreaming Aging in Policymaking in the Region. And it's an interactive toolkit that we have used to build the capacities of governments, which I'll come to next in a later stage. Second, we do regional dialogue. As a regional commission with our convening power, we bring together governmental actors and non-governmental actors in our region in several platforms and forums, the MIPA, of course, being maybe the most important one, but also ICPD, the Arab Forum for Sustainable Development, and among other things. We also try to engage parliamentarians because most of the work previously was done with the executive, and a lot of the time the policies is also at the legislative level. So we now have a annual events that bring parliaments together on the issue of aging and mainstreaming aging in policies. And the third line, which is usually a more thematic focus, and we bring ministerial representatives on specific focus areas. Previously, COVID was, the main title we were focused on. Moving forward, and this is maybe just an FYI, and if any of the organizations or guests attending today are interested, we are hoping to focus a little bit on the issue of older person abuse in the next coming cycle. So anyone who's interested, I'll be more than happy to discuss and collaborate. And then, so the first was knowledge building, the second was regional dialogue, and the third is direct support to our member states. So we are now having, I'm working around with 9 countries. In most countries, what we do, and first, it was a process to get here, because we wanted to put aging and older persons on the policy agenda. And if you were to speak to me 5 years ago, I would tell you it's almost non-existent, it's not there. 5 years later, we have seen a shift. And now more and more countries are coming to us and to, of course, other UN agencies, saying we need support with the portfolio of older persons, how to ensure dignified aging, active aging, so on and so forth. And what we do with our member states, we again, try to provide minimum baseline of knowledge. A lot of the time we struggle in our region with availability of data, disaggregated data. So that is, a first building block for responsive policies. The second is we work with them in a very participatory and consultative process to develop relevant strategies, action plans, frameworks for older persons and aging. And the reason why we focused on that as a first step is, first, they're not there, and a lot of the efforts that we have seen in our governments are fragmented. And so we said, okay, as a maybe first step, let's try to have a coherent framework in place. And third, and in many of our countries, we are seeing more demand on the issue of long-term care and long-term care economy. And that is an area that we have not necessarily worked on in the past couple of years, but will be on our plate in the next coming years. And already we have several requests from our countries in this regard. I think I'm actually going to end here. I wanted to be brief and I didn't want to take too much of your time, but if there are specific areas you would like me to focus on, I'm more than happy to do that. So thank you for your attention.
We thank you for the very comprehensive description of what is available and the work that you do. And we will go back to you indeed on something that has, I guess, gathered a lot of interest, which is training of parliamentarians, because as you say correctly, we do engage normally when we see government, we engage mostly with executive branch, but both are important. So thank you again. Let me now continue with this global overview, going to a new region, to the Americas. And I will introduce properly our colleague, Cristina Sousa Rodriguez. She's a Protection Associate Community Officer at the UNHCR, the United Nations High Commission for Refugees, where she works on youth education and strengthening the focus on age, gender, and diversity. She has more than 8 years of experience working with refugee populations and the population victim of conflicts. She has worked also with civil society organizations and has developed other projects with the Colombian Embassy in Costa Rica. So it's great to have an expert like Ms. Sousa Rodriguez, and I would like to offer her the floor. Cristina, welcome.
Thank you so much, and thank you for the opportunity for us from UNHCR. It's very important to visualize the older persons on the move. What is the obstacles and gaps that we have with this population? So I will share my screen.
Please.
Share, please. Do you see my screen?
Yes, you just need to make it exact. Now we see the slideshow. Thank you.
Okay, perfect. Okay, first of all, it's very, very important to understand the context of the displacements in our region in the way that we can understand very well in what position are the older persons that be forced to displace in our region. In Americas, right now, we suffer an unprecedented displacements in our region. It's very important to understand that, sorry, I have a problems here with my, yes. 1 of 6 displaced persons globally are in the Americas, so we are represent the 60% of the people in forcible displacements, according with the different situations that we have. In what example, we have the situation for the Venezuelan persons that represent more or less that 71 million persons, in the way that 80% stayed here in Latin America and the Caribbean countries. And the other situations that we have in the Americas is the situations that occur in Central America and Mexico, that it's combined different nationalities, people from the countries from the North or Central America, but in the same way, people from other nationalities as Haitian, Ecuador, and others, even include nationalities outside our region, you know, people from Africa, Asia, MENA, etc. And the other situation that we have is the IDPs, internally displaced persons, that continue to increase in our region. As you know, the case of Colombia, that only in this year, in the half of the year, reported 84,000 new IDP persons. But in the same way, we have the same situations in countries like El Salvador or Honduras. And as you know, for example, the new route that it's very, very complicated and dangerous is the Darien route. That it's complicated because of the different migration policies for different countries. Right now, we have people try to go to the north, other people try to return to the south, and other people only stayed waiting what is the next step that they need to do. So for that, for now, it's very complicated context in our region, and in this panorama we have the older people in the move. In our office, in a bureau, in a regional office bureau, because we have a policy that it's an age, gender and diversity approach that we need to mainstream in all the works that we do, in all the units, because in the entire programmatic cycle, it's very important to understand that the displacements is different according with the age, with the gender, the diversity, the experience, the backgrounds, the educational levels, and other stuff. For that reason, we try to start to visibilize the different situations, and for that, we work with HelpAge, international NGO, in a regional assessment in the way that we can understand very well what is exactly the situations for the older persons on the move that stay in the Americas, and how we can improve our approach with these populations according with their necessities, according with the principal findings that we found in the assessments, and how we can really connect our programs with the reality of these populations. For that reason, we construct these assessments. We did in 5 countries, in El Salvador, Honduras, Colombia, Ecuador, and Peru. So represent the different situations that I mentioned before. And these regional assessments, it's called A Claim to Dignity, Age on the Move, and represent different possibilities on how these persons move, how's exactly the reality right now. These regional assessments was did during the COVID pandemic, so for that reasons even include how the COVID impacts the older persons on the move. Some of the principal or main findings that we can share with you is, for example, 11% of the older persons on the move live alone, but more than half require daily support. So for these people that live alone, it's more difficult to get this possibility to have daily support, and sometimes they depend for example, the neighbor, or depend for a social organizations, or either they pay for the church, or another because they don't have this network support. And the other 58% have not received humanitarian aid, and so many reasons for that. For example, they don't have this information, it's very difficult to move in one place to another, they live in a very isolated place. So for that reason, they don't know how they can go to these places and receive this humanitarian aid. In some cases, they don't have the knowledge about how is the process to apply an asylums or have documentations. For example, 1 and 2, the older persons on the move that was part of this research said that they feel discriminated against there because of the age. We found some difference in one area to other area in the same region. For example, in persons that live in Central America, because it's more about the internal displacements, they have the documentations, but the people that live in countries as Peru, as Colombia, that is more Venezuelan people, they don't have access to documentations. They're living in a regular way. For that reason, they are invisible for the states and don't receive the benefits that maybe the people in this age can have access, because they don't have documentations. The 79% report that have an informal job. So it's very, very complicated because it's very limited in the way that they have economic situation that be sufficient for them. And because of they continue on the move, and sometimes they started very young in this move, or they started to move and internally and then be forcible to move to a second country. Some of them, they don't have the option or the possibility to receive a social pension. Just 10% said that received them, and the rest said that they don't have the opportunity to get this even in the origin country or in the new country that is staying. So the situation is more vulnerable when we set this idea how we could survive the older persons that stayed on the move. And it's very important that other topics that it's continually being empowered for all organizations, for the international organizations, and for all the principals, persons that work with the older persons, is the participations and the consultations and the feedback mechanism, because it's necessary to be implemented and planning according with the necessities, according to how is the way that the older persons be related with others, how is a space that be very comfortable, very practical in a way that they feel belongs to this participation process, in a way that be part of this community. It's important to understand that, for example, the vast majority of the survived older persons for this specific research live in a situation of great economic vulnerability because the different situations as exploitation, sometimes they continue carrying other persons, even they need daily support, but they continue be the principal support for kids, for older persons, for persons with disabilities, and it's more the woman present a higher percent of no participation than men, and even because sometimes they are the principal carrying for others. So they will continue with the same cycle, where the women continue be the more affected for the different situations that affect the older persons on the mood. For that reason, and in the way that how we can improve our work, and how we can really mainstream this approach of the age, specific with the necessities of the older persons that we can identify. we started our work in a training process with the colleagues in the field, in the way that we can really understand what is the specific approach, what we need to implement, how we can strain our programs and our assistance. So we start this year, we create a facilitator guide for trainings and with different modules according with the different topics that we identified in the research. And the idea for the next year is to start to replicate this process and to create different cycles of trainings in the way that we can really mainstream our response and how we can create or design a response very tailored according to necessities of other persons. For us, it's very important these types of spaces because we can really visualize what is the reality. In the house said before the other panelists, the situation it's complicated in some regions. It depends on many factors, externals and internals, and the way that the people live right now. But for the people that stay on the move or be forcible to displace, the conditions are worse because they don't have the possibility to create a real incomes. They sometimes are invisible because they don't have documentations, and sometimes the lack of information and the lack of the real participations explore or exacerbates the protection risk that there comes. Thank you so much.
Thanks to you very much indeed. And my appreciation for telling us what is happening in the region, a very dramatic situation that requires immediate attention, of course, as you are already doing. And I will go back to you on the training of older persons, quite interesting as well. But now, let's move with these regional and country perspectives that we are having. And allow me now to introduce our colleague, Madame Aneta Eustas. She will be giving us the overview of what's happening in Greece, quite unique and special. Madame Eustas is a protection officer, also at the United Nations High Commission for Refugees in Athens, in Greece. And she covers the country office community-based protection portfolio, which includes accountability to affected persons, persons with specific needs, communicating with communities, working on gender-based violence, child protection, non-formal education, protection from sexual exploitation and abuse, and issues of mental health. She has a vast field experience in refugee and IDP, in internally displaced persons response since the year 2010 in the Central African Republic, in Georgia, in Armenia, in Ethiopia, in Greece, and has also responded to the Ukraine emergency in Poland. So quite a unique experience and view that she will share with us now, focusing on Greece. So allow me to welcome our colleague, Aneta Eustas. You have the floor. Welcome, Aneta.
Hello, and a great thanks to UNITAR for organizing this event. Please just allow me to share my screen.
Of course.
And if I can have a confirmation if everyone can see the PowerPoint now.
We can see it. If you can make it a slideshow, that would be very good.
Yes, okay, great. So today I'm going to focus specifically on Greece and UNHCR response and sharing the voices of older refugees in Greece. In Greece, as you know, it is a country where we see a high number of transit of displaced persons moving onwards to other European countries. We have over 50 different nationalities that have crossed through Greece and continue to transit through Greece. In Greece, UNHCR's role is to support authorities in the refugee response, to advocate for refugee access to rights and services, and under the framework of accountability to affected persons, to consult with refugees on their priorities and on their recommendations which we use to guide our advocacy with the state and our interventions. Just to highlight to a link, we will be sharing after this some resources that UNHCR has, the policy on older persons, age, gender diversity policy, for everyone's reference as well. So over the years with the refugee response in Greece, when we established a first-line reception response program for urban accommodation for asylum seekers, older persons were prioritized to access the accommodation for asylum seekers. This was a housing scheme that was then handed over to the Greek state. This is one way where we practically advocated, first included in our program and then in the state's program, to make sure that older persons have access to accommodation in priority. We very often see gaps in access to social allowances or other allowances for displaced older persons. And we have developed a protection cash scheme as a safety net to cover basic needs, but also support older persons to link them to integration where possible. And we are also including older persons in our refugee outreach teams in our community-based protection interventions. Today's presentation, I'll focus more on our participatory assessment, which is an exercise that UNHCR does annually in each operation, where we consult with older persons, well, with different refugees of different profiles, using the age, gender diversity approach, so that we hear the experience of different groups, different nationalities, as each individual may experience displacement differently. In past years, we have not had a focus on certain groups, and for this reason, this year we really just targeted older refugees to understand their experience in displacement, their experience in Greece. And an overview of the findings is, for one, not all older persons are vulnerable. It really depends on several factors, something we call intersectionality. Some may have medical issues on top of age, or might have the social vulnerability issues presented by the first colleague. Also, older persons are not eligible for pension in Greece, and this was also an issue that was raised by other colleagues, where they cannot be financially independent. They may be eligible for other social allowances. However, there's many bureaucratic obstacles to access the allowances. We find that most older persons are heavily reliant on family, friends, community-based organizations, CBO, or non-governmental organizations to cover basic needs, to receive food or non-food items. And they are actively looking for work. Many older persons are looking for work, are looking for a way to survive, permitting their medical conditions. Language and age are the main obstacles, even to find informal jobs, so knowledge of the Greek language specifically. So the challenges mentioned by older persons were accommodation, meeting their basic needs. Some are serving as caretakers for their adult family members who are living with disabilities. So this is an additional burden on them. They also face age discrimination when trying to find work, meaning that they are misrepresenting their age, saying they're younger than they actually are, in order to find even informal work, to survive, to meet their basic needs. They rely heavily on family members or the community for interpretation and access to information. And they prefer to receive information in person, and especially face interpretation challenges in hospitals. So some opportunities, part of our approach is to also look at the opportunities. So we do see that older persons want to and can actively contribute to society. They can share knowledge, serve as caretakers, support others' work. And in Greece, we find that they're making efforts to learn Greek and also to learn to write in their own language for the first time while in Greece. And just below is a short quote from an older Afghan refugee woman. I'm learning to write in my own language for the first time as an old woman in Greece. So we find that they are still actively learning, trying to integrate and get by their daily tasks in this regard. For documentation, some of the challenges are the long waiting times in the asylum procedures, lack of information on the social allowances available to them or how to access them. And what we've seen with some are the double issuance of IDs, which prevent them from accessing any services. Regarding community engagement, it was noted that many events are organized for children. So there is a focus on children in the refugee response in Greece, but not so much for older persons. And this was a request from older persons to have more events specifically for older persons to combat the isolation and loneliness. Also, we found that individuals with previous ties to Greek society or networks are more likely to have a social network and be active in the community. A quote from an older refugee from Ukraine: "I used to live in Greece before and I have a supportive network of people." So we see this depending also whether they have the network. They're able to be more secure in terms of mental health, in terms of even meeting basic needs and even finding employment sometimes. So the majority of refugees that we have here, they prefer to receive information in person, and older refugees noted that they trust the government more as a source of information. We also found that among the older Ukrainian refugees, some are digitally literate and are actually actively using social media and chat rooms to receive information directly. Overall, in Greece, there is a sense of security. Only concern was petty theft, but overall, there weren't any issues in this regard. And recommendations from refugees to the authorities. So these are just a few of many recommendations. One is from an older refugee who's on Lesbos Island. "I recommend improving the management of resources provided by EU countries to authorities to support refugees, so that persons in need will benefit more from this assistance." So this, it is a perception that the support isn't reaching the most vulnerable in the view of this older refugee. Another quote: "The Greek government should give us the same money that the retired Greeks are receiving. We lost everything. As you know, we're getting 50 to 80 euro pension from Ukraine. This money was to cover basic needs in Ukraine, but here it is nothing." So we continue to see this issue of pension, and this is especially where you have displaced populations. Access to pension in the country of origin may be impossible in some scenarios, while others do receive the pension, but it's insufficient to cover their needs in the host country. Also, we have recommendations from refugees to other older refugees. So we have an older refugee from Sudan saying, "Stand on your feet and try your best to become independent." And another older refugee from Afghanistan: "Older persons need to help and respect themselves, be active, and the help will return from others." And then another quote that saying that refugees should organize first at the municipal level, then at the central level, and look for UNHCR to advocate so that they have access to the finances to meet their basic needs. Just to complement the participatory assessment that I just presented on, we also have a protection monitoring, which is more of an individual interviews and summarizing the views from two of the main groups that we interviewed of older refugees from Afghanistan. The top needs were financial assistance, employment, health, followed by language, while for refugees from Ukraine, financial assistance, accommodation, employment, health, followed by language. This is the Greek language. Just to note that we don't see accommodation among the Afghan because at the time we had the Estia, housing support in Greece, from which they benefited, which the Ukrainian older persons do not. We also find that in the community-based organizations of the Ukrainians, where they have support to their communities, 1/3 of the recipients are older persons that seek food items and vouchers. Finally, to end with some reflections, perhaps just for thought, what role or obligation does the UN have towards older persons? And as you know, there's many UN agencies, so this is a very open question. And then what role or obligation should states undertake to support older displaced persons? So specifically for refugees who are older, who are displaced, and who cannot sometimes be active members of the labor market or can. With that, I include and thank everyone for your attention.
Yeah, thanks to you, indeed. We will discuss a little more. I'll just present you an additional question on these priorities that you have mentioned from several perspectives on several countries: financial assistance, issues of health, issues of employment, and so on. But before we do that, allow me to continue with our journey, as I had said, a mental journey at least, on a global basis, and now go to Africa. It is our pleasure to welcome Madame Adua Kofur Owusu, a senior advisor in Nigeria at the Office of the High Commissioner for Human Rights. She has worked right here. Yes, thank you for putting it on the screen. She has worked at the UN in various positions at headquarters and in the field. She has experience in international human rights law, particularly on marginalized groups and related jurisprudence. Her particular focus has been gender, women's rights, peace, and security, included in the context of the UN African Union hybrid missions, and also by supporting research, policy work, partnerships, and advocacy in integrating human rights within the work of one of the UN country teams. So it is a great pleasure to welcome our colleague, Adua, and the floor is yours. Thank you for being with us.
Thank you so much. Thank you, colleagues. And thank you, UNITA, for this invitation for the Office of the High Commissioner for Human Rights to be part of this conversation. As you rightly said, I'm speaking from the perspective of Nigeria, where we've just recently had the visit of the independent experts on older persons, Ms. Claire Muller, who was here with us. And Nigeria, like what my previous colleagues have said, and especially the video, which we saw at the beginning, which was very powerful, reminded us all that by 2050, also the aging population of Nigeria will be increasing beyond those who are 60 years old. I'm representing the Office of the RCO and our resident coordinator. He's convinced that older persons are a nation's asset, and as such, we must all work to unleash their potential. And for this, we have just concluded our new cooperation framework, which will guide the work of the UN and, of course, the government of Nigeria from 2023 to 2027. A large component of that includes the groups we've identified as being left behind, included older persons. And we are, the UN here, we are supporting the government in strategically addressing the issues faced by older persons. By focusing on their diversity, the country has, as you can imagine, the most populated country in Africa. It has a diversity in terms of the federal level and the state, and including even within those older persons, trying to identify those who are furthest left behind within that group. What we have been doing is supporting also older persons' entrepreneurship. We are working with the Citizen for Senior Persons, which was recently set up by the president, who himself is also forced into the category of older persons to try and harness some of the skills that older persons have in this country. And this has really related to sharing of knowledge, passing on skills, passing on For example, we work with them on weaving, on craft, and these are all knowledge that are dying out with them as we increasingly have an urbanization in the country. Also, of course, Nigeria is a country which has, unlike where the other speakers have originated from, where we have conflicts and crisis in the north of the country and across, and displacement in many of the different parts of the country. In our peacemaking efforts as the UN, we are making sure that older persons, in particular women, play an important role in peace building and conflict resolution, not only as carriers of pre-conflict narratives, but also as people who have active contribution to make based on their history and based on the experience of communities, and who are, I think we heard earlier from the speaker from, if I'm not mistaken, from North Africa, about the respect that elder persons have in our communities, and building on that to encourage peacemaking at the community and at the local level. We are also, in a context of displacement, monitoring human rights of older persons at a very micro level, but equally important, looking at how displacement impacts on older persons. And this is also linked to the issue of climate change that we are seeing in the country, and older persons displaced not only from conflicts or insecurity, but also by climate change and other environmentally related disasters, if you like. And that obviously came in very useful. We've had a series of flooding over the last 2 months, where most the southern parts of the country were flooded, and most of those affected and whose needs were not necessarily reflected immediately in the response was older people, older persons. And these were those with all kinds of health issues, including those who needed with diabetes or high blood pressure, this type of thing. And this is where our monitoring, we were able to feed into the response of the UN by shining a particular light on this group. We also believe here in the UN, in Nigeria, and in the work we are doing as OACHR, the older persons, of course, are themselves best advocates for their own needs. And I think we heard from the speaker from Greece, or the interviews they're doing, that they're best able to tell us about their needs, their concerns, and also to be able to claim and exercise their rights. And for that, we are working with a CSO, one of the oldest first coalition of and by older persons here in Nigeria, called COSROPIN, and other civil society organizations to advance the human rights of older persons. And this includes, I mentioned already, talking about entrepreneurial skills, building on this knowledge, and making sure that older people, older persons are able to also cater for themselves. The country here in Nigeria is changing with the demographics, with a lot of migration and movement to urban centers, which are leaving a lot of older persons neglected in their homes without the traditional family support or units that we have previously in some of these countries in West Africa. The government has established the National Senior Citizen Center, which is doing a lot of work to identify these needs, and which is also working with the UN, and we work with them to find out, especially in communities where we don't have access, for them to tell us as well what are their needs and how, as the UN, we can better support and ensure that the rights of older persons here in Nigeria is respected. And as part of promoting the socio-economic and political inclusion of older persons, we have been advocating, and we are hoping this will be passed into the law in the coming and I think we are expecting to have a success by the beginning of next year, into law of older persons' rights and privileges bill. And also we've been doing advocacy around the ratification of the protocol to the African Charter on Human and People's Rights on the rights of older persons. So in short, our work has involved advocacy around law reforms, but also practical monitoring and engagement with the government, and also within the UNCT, to make sure that whether it's the health needs, the or even the livelihoods needs of older persons in the country forms part of what we are delivering. And they are also part of the people that we are here to serve, both in the federal, but also in situations of conflict and displacement. Thank you.
Thanks to you. And indeed, very unique perspective that we would like to go back to as soon as we put this thing in context. So as a moderator, I'm always privileged to be following the previous dialogue that we normally have with all of you, and my colleague Ana Lucia Jacome has been also discussing this topic with you and has just sent me, this is why I'm mentioning it, she has just sent me by WhatsApp some questions that would be relevant for us to go over. So allow me to, Ana Lucia, you are of course listening to us, and we have concluded the presentations. But now, as we want to go over the questions, please help me out and tell me if the order would be correct. But I would like to present the first question to our colleague, Mr. Rintaro, who's still, Mr. Rintaro Mori, who's still with us, and is as follows. From the floor, someone writes, thank you for your excellent presentation. And here's the question. While civil society organizations support and fully embrace the life course approach, it is crucial to emphasize that the life course means exactly that, the whole life course. So for young girls and women to age with dignity, there is a need to also be, to also have the right policies for older women in place today. How can, this is the question proper, how can we apply the life course approach without forgetting older women as well? So back to you, Mr. Mori.
Yeah, thank you very much for the question. Actually, I already answered in the sort of the comment, but I think I'm going to repeat my sort of the kind of my reply. Certainly, I think I absolutely agree. I think the life cycle approach means that it's including all generations, including all the persons, as well as all the women and men. So certainly, I think I think the life cycle approach means that we just don't want to look at specific populations. Because I think if you look at this, for example, disability, the needs of disability, or the healthcare needs, and also sort of the certain, I think the cares, or the, for example, pick up the loneliness of the older persons, any issues actually, it's actually all actually generations. So we actually need to focus on the needs and the demands, and also the choices of every person. But still, I think that there are certain specific actually policy support required for the older persons. I think they will support in that. So I think it's actually quite a bit challenging, actually, so to say, you know, if we actually just focus on the younger persons, we actually tend to forget about the older persons. That's why I think we focus on the old generations. And also, I think I mean, how are we going to not forget about older persons? All depends, and actually on the sort of the needs and the current population in the country. So we actually, what we need to do is actually we need to look at a specific context. We actually sort of the colleagues talked about displaced populations. Certainly, I think many different type of issues really context, you know, the very specific context. So, for example, some of the sort of the countries with a very young population, you actually want to focus more on the investment for the future. Where I think some of the sort of the very aged population, you might want to focus on the current needs, which is the older persons. So it's all very contextual. But I think the life cycle approach gives you that you can actually tailor the support, to address the actual context. Thank you.
Thanks to you indeed, dear Rintaro. Very holistic answer and approach. Now, let me go to the next question to our colleague, Ms. Sarah Salvan. And I didn't mention this before, and I see that there are several other people interested in the same training, capacity building, and engagement with government. And then you mentioned parliament. It's quite unique because we are used, as I said before, I'm a former government official myself, we are used to see the UN engaging with national government, federal governments, even sub-regional and local governments, but with parliaments very rarely. So can you give us some comments and examples on how you do that from the ESCOL perspective, of course?
Sure, and thank you for the question. Indeed, as you said, traditionally our main counterparts were the governments and the other stakeholders, the CSOs, the think tanks, the academics, the experts. And from our interactions with the governments, and as we try to do the problem analysis, we realize that a lot of the issues also fall with the policy framework and the laws that are existing that govern protecting and empowering older persons. Either they're non-existent or the existing laws in place actually, are not necessarily very conducive for older persons' rights. And so the idea came, okay, if all these policies that are being passed, not just older persons' laws, but the traffic law, the justice law, whatever law it is, that has an impact on older persons, most of them actually are blind to older persons' issues, priorities, etc. And the MPs that are working on them are not necessarily as aware of older persons, their issues, and what they can be doing. And that's where the idea originated from. So we started 2 years ago with a group of parliamentarians representing the national parliament in our region. And we have annual meeting, usually thematic. First of all, it was more about awareness raising to say, okay, here are the issues, here are the priorities, etc. And here are things that you can be doing. And also to encourage peer learning, because we have varying experiences in our region in the parliaments themselves. Some parliaments are more active on issues of older persons, for example, pension laws, health services, so on and so forth. Others, not so much. And so we wanted to encourage this peer learning, especially when it's within the same region. Usually, there's like this, okay, if my neighbor can do it, so can I kind of mentality due to cultural similarities and context. And so that was the second thing. And now the third thing is we worked with the League of Arab States, another regional entity, and we're developing a model draft law. Because in most of our countries, actually, there are no laws, no specific laws that govern older persons. And to what extent are they mainstreamed in the existing laws? That's also questionable. And so we're developing this draft model law. It should be finalized by the end of this year, in the next few weeks. And the next stage is in the coming year is we will be hopefully be working with the national parliaments to basically nationalize those laws, whether through a specific law for older persons or for mainstreaming older persons' issues in available legal frameworks. So thinking of parliamentarians as advocates for older persons, I think, is important. They are an important link in the policy making process, and it's important to bring everyone around the table, basically, each in their own different capacities. So that's what we've been doing, and so far it's growing. It's not ideal, definitely more can be done for sure, but it's important to think about the full cycle of the three branches of government, the full cycle of policy process, and how participatory really is it all. These are some reflections from my end.
Thank you very much. Also very helpful indeed. Now, time is running, so let me go straight to our next speaker, Ms. Cristina Sousa Rodriguez. And she was giving us this very unique perspective of what is happening in Latin America, particularly the case of Venezuela, she mentioned several times. Can you give us an overview for everyone listening, dear Cristina, on the main needs of the people emigrating out of Venezuela, older people, right? You mentioned in passing, but what can we do to ensure that they do that with dignity, older people out of Venezuela, please?
Thank you so much. Yes, right now, for the Venezuelan specific situation, it's very complex right now. So in some cases, we found older persons that continue living in a close community from Venezuela, for example, in the border communities. In other cases, they are part of the family reunification. It's not necessary they decide for all alone to go out to Venezuela, but they are part of a family family and they continue to travel with this family. In the first of all, the first is the documentation. Why? Because in some countries on our here in Latin America exists benefits programs, exists as humanitarian assistance, but in the end, if the person doesn't have a documentation or don't have a regular status, it's very complicated to access this type of programs, and the persons become more invisible for the governments. And the other part is that for international organizations, for NGOs, the problem is in some cases the older persons, they don't know, they don't have this information or how we applied or how we part of this humanitarian assistance, or they live alone. Because, for example, the empowerment in the older persons is related to factors such as participation, physical accessibility, and the ability to move to one place to another place. If it's a person live in a rural area or very insular area, or they don't have somebody as a network, a support network here, it's very complicated. Go and trying to apply for the assistance. And the other way is the necessity of the government to recognize the rights and the dignity of the persons, even there are part of the move, are not have a documentations or be another international protections measures or be asylum seekers. In this way, the idea is the governments to recognize the different documentations, the human rights documentations about the protection of older persons that right now is not necessarily the general rule in Latin America. For example, one of the recommendations that we did in this assessment is exactly that. How will the states know about this international framework, how they can apply this international framework without any discriminations in their territories, and how we understand that all older persons need to be lived with dignity, even they are in regular or regular way. For that, it's more a comprehensive work for advocacy with the governments in the way that they can recognize this international framework in human rights for older persons. They recognize and apply it in their specific laws and recognize without discrimination. And in our view, specific in the work that we do with the communities is to understand how we really can mainstream all the necessities and exactly response that they need according with the realities, and even in the humanitarian assistance. It's not the same the food kit that I will be one person because a shy person, even is an older person. I very understand what is a specific need. And for that reason, we work very hard in improve our capacity, our knowledge, and how we can reflect exactly our policy, the age, gender, age, and diversity approach, specific with the older persons. So we work in two levels. One level is this level of advocacy, but it's an advocacy that we don't need to be alone. It's an advocacy that we continue working together with specialized organizations, in global organizations and local organizations. And the other is how we can improve our response, how we can give the voice to the older persons and empower the participations. And in the specific of Venezuela's people is to recognize that they continue and be forced to displace, and how we can really recognize the rights in the different countries that they come. Thank you.
Thank you. Thank you very much. Much appreciated. Now, I'm trying to make the most of the time that we have, and I'll go straight to Madame Aneta or Anita Ostas, that describes so well the case of Greece. We have received from the floor the following. The question is as follows. Is palliative care available for refugees with chronic and terminal conditions in Greece? And that leads me to ask you a little wider question, which is in all these things that you mentioned that the refugees would need in terms of financial assistance and to find work and issues of healthcare. Can you describe a little more, in addition to this question of palliative care, if access to healthcare is improving as we are moving, or it remains the same. So back to you, Anita. Thank you.
Thank you for these questions. I did a quick Google search, and palliative care is indeed available in Greece. So yes. The second question I saw, it's specifically about the Ukrainian refugees. And under the temporary protective status, they do have access to healthcare equally as Greek citizens would. The major issue that they face is interpretation in hospitals or doctors, to communicate with doctors, or to access the medication that they had back in Ukraine, which is different in Greece. So they can't find the same exact, but other than that, they can access healthcare. We have had other issues with asylum seekers or refugees accessing healthcare in the past, but with advocacy and some actions from the government, we have been able to overcome those. If I may just speak a bit more about the most vulnerable individuals who are living with disabilities and are immobile or have very severe cases that the Greek system is unable to support. Many of these have been supported through a EU relocation scheme. To clarify, this is not resettlement, as UNHCR does not do resettlement in Europe, but under the European Union and the member states mobilized to support the most vulnerable, including older persons, to relocate them to member states who offered slots and who provided the more targeted medical support in those different countries. Thank you.
Indeed, thanks to you, very, very useful. Now, I have also here a question from Madame Adowa Kufur from the chat, and Ana Lucia is graciously also sharing this here on my phone. It says the following: in order to implement the UN Decade for Healthy Aging, what are the core elements to bear in mind for succeeding while building capacities and fostering a national dialogue to develop of policies? What do you think are the core elements to do this in Africa? Please. Are you with us, Adowa? I think there are some connectivity problems. So then I will need to present the last question to all of you, distinguished participants, because it's the most important, I believe, and to hear from you, that would be important. And before I do so, I want to recognize Ms. Silvia Perez, who has been listening, and she's a great friend of the house and is doing a great job in related to what I'm going to ask now. But at the same time, I would also like to mention that the UN Decade of Healthy Aging has very many senior people involved. Another person that we would like to mention in this webinar that is also present is Madame Claudia Mahler, who is the United Nations expert on the enjoyment of all human rights by older persons at the Human Rights Council. It's really a privilege to have all of you involved and listening. But then the question to all the panelists is as follows, and please react to it. It says, would a human rights convention, this is about having a convention on aging, right? Will a human rights convention be a good tool to support your work at the national level or regional level to work to improve the situation of older persons and human rights? So will a United Nations convention on the rights of older persons be useful? Let me begin with Dr. Mori.
Yeah, thank you very much. I think the short answer is yes, it would. I think it will actually sort of they help actually raising the issues. Well, so certainly, I think the main sort of the theme of this today is the mainstreaming the sort of the aging issues. And I think the Human Rights Convention for the Older Persons, certainly, we've been trying that, I think, for many years, but I mean, so far have not been successful. But I think it will raise sort of the awareness, and I think around sort of the issues, and particularly I think for the countries where the aging issues is not pressing. So it will, but certainly, but I think the one of the reasons why I think there's some of the sort of the member states is a bit of a sort of they has a reservation to promote the human rights, or the Convention of Older Persons is, well, I think what with the specific issues on older persons. Well, we have a sort of the Convention for the Human Rights on the sort of the people with a disability, which could be applied to the sort of the older persons as well, if the older persons has an issue with the physical or the mental sort of the disabilities. So whether we should have a sort of the convention for every specific population or not, that may be sort of the question we always been asked. So it's sort of the kind of the mixed sort of the issues, but I think certainly, I think I'll come back to the beginning. Yes, certainly it will. Over.
Indeed. Thank you so much, Rintaro. Well said. Well, let me continue this last round now to Sarah from the point of view of the Regional Commission, which of course has an all-encompassing work, in this case in Western Asia. Will our convention help with your work?
Again, it's I would have to agree with my colleague, Mr. Rintaro. The convention is yet another tool. It's not, the end of all ends. It's yet another tool to pressure member states, especially if it's, it's more legally binding. Right now, we don't have any legally binding frameworks on issues of aging and older persons. And whatever governments do, they do out of moral obligation, out of, respect for population, out of perhaps worry about the future. But when we talk about issues related to a set of coherent rights, of overall rights of older persons, right to housing, right to health, right to dignity, right to protection, right to safety, all of the above, it's still MIPA definitely provides a framework, although it's not binding, legally binding. So short answer to your question is yes, it would be another tool that we would use to rally member states, especially those that maybe aging is not on their policy agendas, so that it becomes on their policy agendas. And we have seen it. We have seen the impact of, as you said, conventions for women, convention for disability, etc. We have seen the impact of that on the government's policy priorities. It does, etch a place basically for the issues of older persons. Now, will it necessarily bring something new? Will it have its teeth, that will make it more forceful? Will that, be an issue of mainstreaming? Will it be redundant? These are all fair questions, and they are to be thought about for sure, and what the implications of them on our work. So I think that's my answer, and over to you.
Thank you very much. And before we conclude, we have only 3 more minutes. I would like to thank our colleague Cristina for sharing this website, agingonthemove.org. You can see it on the chat, but it's rather simple. Just go to Google, agingonthemove.org, which is a website, a microsite that has the report mentioned on what's happening in Latin America. Thank you, Cristina. That's very proactive of you. And last but not least, I would also like to share that our colleague Aneta shared part of the HCR, the High Commission for Refugees website, on the policy and guidance document on older persons. And that is, of course, at unhcr.org/ very simple, older-persons, unhcr.org/older-persons. So with that, and I guess time management is of the essence, I would like to thank all of our panelists for the time and effort that they have made today to help us digest this very important issue and to raise awareness about issues of aging in these particular regions from the angle that we use today. And last but not least, I would like to recognize my own team at UNITAR, Ms. Ana Lucia Jacome and Madame Beisanura Lada. They do an excellent work. Most of you know that. But to all of you, dear participants, I would like to end by ratifying that UNITAR, as well as all the United Nations entities represented in this website, will remain committed to support the decade of healthy aging that occupies today. And with that, you will be receiving emails from us announcing the next series of events in 2023, as we have done in 2022. Ana Lucia has led in this process 5 different events, all of them very successful, very interesting, and the feedback that we are getting is rather positive, so very positive actually. So in 2023, we will launch the next series. With that, thank you very much indeed.